Next question, member for Brantford-Brant.
Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care. Post-traumatic stress disorder, or PTSD, according to the Anxiety and Depression Association of America, is a serious, potentially debilitating condition that can occur in people who have experienced or witnessed a traumatic incident. PTSD can seriously affect all aspects of a sufferer's life, including their job and their career, and can often lead to other mental health issues such as anxiety, depression, substance abuse, and risk of suicide. PTSD has become a global health issue, and the prevalence of it is gaining awareness. In Canada, between 1.1 to 3.5% of the general population is thought to have PTSD. In 2016, Ontario amended the Workplace Safety and Insurance Act 1997 to presume that PTSD is a workplace injury among first responders if it arises out of and in the course of the worker's employment. Mr. Speaker, through you, I ask the Minister of Health and Long-Term Care what initiatives her ministry is taking to address PTSD.
Thank you. Minister of Health and Long-Term Care.
Thank you, Mr. Speaker. I want to start by thanking the great member from Brantford-Brant for this very important and timely question. PTSD is a significant risk to the health and well-being of people who regularly face or are affected by traumatic situations. My ministry will work closely with the Ministry of Labour to ensure Ontario's first responders have access to the care and services that they need. Research shows that first responders are at least twice as likely as the general population to suffer from this disorder. We have been very clear on this issue throughout the election campaign and now as a government. Mr. Speaker, we will support Ontario's public health system by adding $3.8 billion in new support for mental health and addictions and housing. Developing and implementing a thorough, comprehensive and connected mental health strategy once and for all is a priority for us. As we all know, mental health is health. Mr. Speaker, with important increases to mental health funding, families, especially with children and youth with mental health issues.
Thank you very much. Supplementary.
Thank you, Mr. Speaker. Supplemental back to the Minister. On Tuesday of this week, I tabled my first private member's bill entitled PTSD Awareness Day Act of 2018. June 27th was first officially recognized as PTSD Awareness Day in the United States in 2010. Since then, many organizations have followed suit. However, despite Canada, in particular on Ontario, having one of the highest rates of PTSD sufferers in the world, approximately 1 in 10, only the province of Alberta has legislation acknowledging June 27th as PTSD Awareness Day. This private member's bill proclaims June 27th as PTSD Awareness Day in Ontario annually. It will raise awareness and help deal with the stigma attached to PTSD and lead to more fulsome conversations about it in the workplace, at home, and in society. Mr. Speaker, through you, can the Minister tell this House if she intends to support my legislation this afternoon later today? Thank you.
Response.
I do applaud the member for bringing forward this issue and bringing forward his private member's bill later this afternoon. And yes, to answer your question, I absolutely will vote in favour of it. As Minister of Health and Long-Term Care, I look forward to working with our frontline care workers in mental health, organizations like Ontario Shores Centre for Mental Health Sciences, KMH, Children's Mental Health Ontario, and the Canadian Mental Health Association. This government will supply the frontline workers with the supports and resources they need to serve Ontario's patients and families, and that we can finally move forward with a comprehensive mental health strategy for all Ontarians. As the Premier has said in the past, this Ontario PC government will provide faster access to care by enhancing access to primary care providers, by reducing unnecessary emergency room visits, and bringing down wait times. Promise made, promise kept.